I'll start with you, Dr. Eliud. As decision makers, what criteria do you use to understand that a project needs to be elevated at the national level, and who participates in making those decisions?
Decision making is very critical, and actually even deciding which projects needs to go to the national level or even need to be prioritized needs to be done in a very structured manner. As a student of project management, we are actually advocating and advancing the project management office practice, so that just as we have the presidential delivery unit, these projects there must be a think tank behind which projects need to be prioritized, which ones need to be done first, and so on and so forth. And so at an organizational level, you need to have a structure. You can call it whichever name, but from the project management perspective, we are talking about a project management office where you have project management experts who are able to be a strategic partner to the highest level of leadership. At Kenya Institute of Public Health, we are actually an authorized training partner who are providing this certification in collaboration with PMI, the PMP, and the only one, or the only institution in the country now providing PMOCP, Project Management Office Certified Professional. And that is the only way we shall be able to do those decisions better. That's the only way we shall be able to go for the project that makes all the difference. That's the only way you'll be able to say no to some projects and yes to others. And also that structure helps to ensure execution and project success.
What procedures or practical advice would you have to just advise the government on how they can increase on their speed, and cut back on that bureaucratic friction and project delivery?
Having worked in the development sector and seeing the way structures are done or how things move, is a time we explore how we can learn from the best. You will know, like, for example, in China, they adopted the PMI way back in 2000. Currently, they have the highest number of PMP holders, over 600,000. And before anybody becomes a manager, needs to have at least certification in project management. And I'm very happy when we talk about the policy that we are discussing, because that will make a very big difference. We must ensure the people we task to do the work, first of all, have the right skills and knowledge. And then number two, it's all structural, because I usually give a lot of examples because I train a lot of project management professionals. I am humbled that even Dr. seated here went through Kenya Institute of Public Health. We are now having over 200 doctors who are actually almost towards getting the PMP or on the journey to getting that, because we are saying we must advance project management also in health and development sector. And once we have these people who are trained, they understand the language, then have the structures. I started by saying PMO is a foreign language in most of this side of the world. But when you go to the development sector, anytime you have 10 projects, 20 projects you're executing, you need a structure of people who understand what project management is. They are the think tank. They are able to do those elicitation of requirements. They are able to go to the customers. They are able to design the project well. They are able to follow through. And then for the bureaucracy, which is really a big issue, and I know it's not something you can just say it's possible just to do it tomorrow, away with it tomorrow. It's just looking at how can we break down things, how can we decentralize decision making. I give an example. When you work in some of these sectors, you have an authority matrix that the project manager can approve X amount of money without even the CEO. These are the kind of the agile way we need to think, so that all these decisions are not on one person, which makes a lot of lag in the decision making, ultimately causing delay, which in the sector we are in is all about saving lives. So delay in a project might mean somebody is losing life or even having higher mortality. Thank you.